Next on the program, as I alluded to, Manitoba has the second lowest number of doctors per capita in the country. That's from the annual report from the Canadian Institute for Health Information. It says Manitoba has an average of 215 doctors per 100,000 residents. The Canadian average is 247.
That's upsetting, is obviously concerning for me as a physician and for the patients, for sure, even more so. That would be my biggest concern, that someone who needed care didn't get it and were sick and we weren't there to help them.
That was Doctors Manitoba President Michael Boroditsky speaking to CBC earlier this week. Now, the shortage is affecting patients in ERs, seeing family doctors, and people like Rhonda Powers. She visited an ER to help get an abscess removed from her saliva gland, but was told she had to wait 7 weeks to see a specialist. It worsened, and Rhonda had to visit the ER again and is with us now to talk about her story. Good morning.
Good morning.
So can you tell us, Rhonda, about your first visit to the ER and what was going on with you?
Well, it was a little frightening. I had woken up. The kids were coming over. We were going to spend the day at the pool, and the side of my face had puffed up, and it felt hard. We didn't know what was wrong. We thought maybe it was just a bad tooth. And then the next day when I woke up, it was worse. Matter of fact, the pain was incredible, and my husband Scott decided that we should call the dental emergency lines, but we couldn't find anyone. So off we went to the Grace Hospital to emergency. The staff were wonderful. I was in so much pain. When I got in to see the doctor, they had me take a CAT scan so they could see what was going on, and it was a blockage in my saliva gland. The doctor wanted to cut it out, and the on-call throat, ear, and nose specialist said no, that she would see me. And so we went home. They gave me some Tylenol 3s and antibiotics. I went home. It got worse.
What did it feel like?
There was this tremendous pressure on the side of my face. It looked like a balloon. I was prescribed Tylenol 3s, and I was beginning to take at least 6 a day. That's how painful this was.
What happened next?
Well, I would go to my doctor, and he'd ask me how much longer I had to wait to go see the specialist. And all I could do was wait. And when it got bad, I would call her office, and her voicemail just told me to go to the ER. And so Scott and I would go off to the ER. And the last time we went, you could tell it was beginning to break through. The side of my face, it was bright red, and you could see the skin. Something was beginning to break through. We were waiting. I think we were waiting for about 8 hours. And finally, we saw a doctor assistant. All she did was give me antibiotics, or a prescription for antibiotics, and 1 Tylenol 3, and I was sent home.
What was this like for you? Now you've been to the ER twice, as you described. This thing you're feeling like could burst through the side of your cheek, and you're in this pain. What was the wait like?
It was dreadful. I couldn't do anything. All I could do is just go home and lie down. I couldn't focus at work. This is my face. So people would look at me. I'm not a vain woman, but people could see my face getting bigger and redder. And the pain was indescribable. It felt as if my face was on fire.
Did it break through ever, your face?
Yes, it did. It broke through when we were waiting at St. Boniface Hospital. We were there for about 16 hours.
Was this just on one of the visits?
This was the third visit. At one point, I think hour 12 or somewhere around there, this young man, this doctor, he'd go around and he'd check off to see who was still in there. And he came to see me, and my skin broke. It broke through my face. And so he ran and he got me pads and a towel.
When it broke, what was coming out of it? And, give me a sense of that.
It was blood. It was pus. It was brown and red. It was horrible.
Was it the size of a baseball or?
I suppose like a golf ball.
Okay. And then it broke and it's coming out of the side of your face. And what did you do?
The specialist came. And he took me to the back, and then he said to me, cancel your appointment with your specialist. We're going to take care of you from now on. And I just said, thank you. Then he began pushing on the side of my face to get what was ever in there out. And a stone came out. It's about the size of a small kernel of corn. And he said it was the largest one he's ever removed. And he gave it to me. I've got it in a little pill bottle. And I just look at it and think that was in the side of my face.
And it was, as you said at the beginning, an abscess that developed in your saliva gland.
Yes. And even now, the side of my face, its swelling is going down. Right now, it's purple.
So from the first moment that you noticed this and decided, you better go to the ER, to when it broke, 3 visits to the ER, how much time had passed?
7 weeks.
How has it affected your mental health?
It was terrible. It was terrible. I was depressed. I still am depressed. I was tired all the time. I was angry because I didn't know what to do. Usually I solve my own problems. I'm quite independent. And this was something that I couldn't fix on my own. My doctor was very frustrated. Dr. Herrera, my family doctor, he's wonderful. He told me that he was sorry. He was sorry that the system failed me.
So have you filed a formal complaint to the WRHA?
I did yesterday.
And tell me what prompted you to do that. Obviously, we've heard your story, but tell me when you made that decision, why you felt that this was important to do.
I think it was the Dr. Herrera and the specialist at the St. Boniface Hospital, because they both told me this never should have happened to me. Something so simple, something that could have been taken care of so easily, it escalated to the point where the infection, if it would have spread any further, there could have been a lasting impact on my well-being, because already it was beginning to puff up under my eye and travel down my throat. And that's when Dr. Herrera said it was getting dangerous. So,
what would you like to see happen to ensure this doesn't happen to someone else?
Well, I think wait times have to be reduced, not only in emergency, but with specialists, because obviously the CAT scan was sent to the specialist. So she was fully aware of what was going on with me, and she never took my call. This was unnecessary.
What's the prognosis for your health moving forward now?
In 3 weeks, I'm going to see the specialist again. Unfortunately, he said that this could happen again. And now that I have a new doctor to take care of me, someone who obviously cares, I'm really hopeful.
Rhonda, thank you very much for sharing your story.
You're very welcome. You take care.
What a story, right? Winnipegger Rhonda Powers, I spoke with her yesterday, and after the show, we're going to post a longer version of our conversation. It was some 17 minutes on our CBC Listen app. We did reach out to the WRHA for comment on this incident. It says due to privacy concerns, it can't comment on individual cases, but adds it understands that all Manitobans should expect high-quality, safe, compassionate care when they need it, and encourages patients who have an issue to reach out to patient relations to have their concerns addressed.
Thank you for watching the CBC Manitoba YouTube channel. Don't forget to like and subscribe. For the latest breaking news and top stories, download the CBC News app.